Former Alaska Governor Sarah Palin referred to a provision in the House bill as a death panel. Your colleague, Alaska Senator Lisa Murkowski, said this in response to Governor Palin.
It does us no good to incite fear in people by saying that, you know, there's these end-of-life provisions, these death panels. I'm so, quite honestly, I'm so offended at that terminology, because it absolutely isn't.
Senator Hatch, who's right, Governor Palin or Senator Murkowski?
Well, Jake, I don't think I'm going to make that decision. You know, there are many different people who have many different opinions on what is meant by these programs. But what I do know is that the Democrats want a government plan where the government will take over health care. They want to cut Medicare in order to pay for that plan, even though Medicare is $39 trillion in unfunded liability. They want to do a number of things that I find objectionable, such as an employer mandate, a job-killing employer mandate that hurts people on the lower spectrum who really are low-income wage earners. They want to move, according to the Lewin Group, up to 119 million people into Medicaid. If that happens, it would destroy the health insurance programs throughout the country. 8 out of 10 Americans really want their health insurance coverage. They don't want to lose it. In fact, 64% would prefer health insurance to the 19% who say that they would like a government plan where the federal government, nameless, faceless bureaucrats, set what the terms and conditions are of our health care system. Jake, that's what they want. That's what they're suggesting. That's what this administration is suggesting. In all honesty, I don't want a bunch of nameless, faceless bureaucrats setting health care for my aged citizens in Utah.
Senator Specter, is Senator Hatch describing the health care bill properly?
No. Let me come back to the question that Senator Hatch didn't answer. You asked him, did he agree with Governor Palin or Senator Murkowski on the basic issue as to whether the plan provides for death counsels. Senator Hatch didn't answer that. The fact of the matter is that it's a myth. It's simply not true. There are no death panels. And when Senator Hatch comes to his basic point that this is a government takeover, that's simply not true either. The government option is an option, pure and simple, and the private sector will be maintained. And people will be able to keep their current health care plan if they like it. And the employers can be given incentives to stay with the plan that their employees like.
Well, Senator Specter, let me stick with you, because about that government plan, the public option, in May you said you would oppose that, and you've changed your mind, and you, at least as I understand it, in town hall meetings you're saying that you do support the inclusion of a public plan in a health care reform bill. What changed your mind?
Well, I really had only one question on a TV interview, and I gave a negative answer, but that was before. Listen, I don't want the kind of a bureaucracy that puts a gigantic bureau between the doctor and the patient, which some people have proposed, and I'm against that. And my negative answer really went to that. That was before Senator Schumer, for example, has come out with some specifics on a government option. And the government option, according to his plan, is going to maintain a level playing field. And the option is not going to force out the private sector. And I think competition is good. And it is just an option, one of many alternatives with the government option.
Everything the Democrats are doing is pushing towards what's called a single-payer system, where the government basically controls everything. And this public plan, this public government plan, don't think for a minute that that will not destroy the current insurance system. 8 out of 10 Americans are basically pleased with their health care insurance. They'd like to improve it. They'd like to make sure that they have guaranteed issue and that people with pre-existing health care problems are taken care of. And we all want to do that. And 64% of them say they'd prefer that over a government plan.
Right.
And yet we're just pushing like mad to get a government plan here.
Just an introductory comment with Orrin's filibuster. I would use this program to invite Senator Hatch back to the bargaining table, back to bipartisanship. Senator Hatch is a very smart, experienced fellow. I've worked with him for a long time.
And I want to see if Senator Hatch will take you up on your offer to come back to the bargaining table before we go. Senator Hatch,
I want to see too.
do you want to go back to the bargaining table and make this bill better?
Well, I'm always ready to go back to the bargaining table. Heck, I've probably helped pass more bipartisan health care legislation than anybody I know. Hatch-Waxman, Hatch-Dodd, Hatch-Kennedy. You know, we've just had one bill after another, and then they work. And the main reason they work is because we rely a lot on the states. Utah is not Massachusetts. We don't want the Massachusetts plan imposed on Utah. Massachusetts is not Utah.
I have to cut you off there, Senator, but we look forward to you joining the bipartisan conversation. That's what we do here at ABC. We bring people together. Senator Specter, Senator Hatch, thanks so much for joining us today. We really appreciate it.
Jake, that's your answer. Bring Senator Hatch back.
Okay.
We'll have some bipartisanship.
Well, I'll try to get back if they'll open it up and do what's right.
All right. Thanks to both of you.